Welcome everyone to today's webinar, Consumerism in Healthcare, How Patients Are Shifting Their Patient Engagement Strategies. On behalf of Becker's Healthcare, we want to thank you for joining us. Before we begin, I'm going to walk through a few quick housekeeping instructions. We'll begin today's webinar with a presentation, and we'll have time at the end of the hour for a Q&A session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. We will have a series of poll questions during today's webinar. You can submit the answer that best applies to you directly on your screen in the slides box. Thank you in advance for your participation there. And if any time you don't see slides moving or you're having trouble with the audio, try refreshing your browser first, but you can also submit any technical questions into the Q&A box. We are here to help. Today, we will be discussing how consumerism is affecting patient engagement in healthcare, how recent regulations are impacting patient engagement, the relationship between patient financial experience and the overall patient experience, trends and examples of how providers and RCM vendors are shifting patient engagement strategies. Finally, what does this all mean for the revenue cycle tomorrow, and how much planning should providers be doing for it now? And with that, I am pleased to welcome today's speakers, Mac Boyder. Mac is the Research Director at KLAS in Healthcare Consulting and Research with a focus on HIM applications and revenue cycle. Mark Starr is an Executive Vice President at Cure, a patient and provider financing solution. And Melissa Skiba is a Customer Success Manager at HealthPay24, a leading patient payment and reconciliation solution. So all M's today. Mac, Mark, and Melissa, we want to thank you for being here today, and I will now turn the floor over to Melissa.
Great. Thank you so much, Marcus. It's a pleasure to be here. So we're going to start out today with a poll question, and there'll be a couple of these throughout the presentation today. So the first question that you'll see on the screen, have you recently gone online to buy something and had a confusing or disappointing experience that prevented you from going back to buy again? And we'll just pause there to give everyone a few seconds to answer that. All right, so looks like we have some mixed reviews, but for the most part, 70% say yes. And so moving on, I thought you'd get a good laugh from this, and I thought this would be a great start to our discussion today to get everyone thinking about the financial side of patient engagement, which is what we're going to focus on here today, hence that question that we just asked. So imagine if other businesses work like health insurance industry. And as Marcus mentioned, we're really here to talk about consumerism. And so I thought we'd start out with some definitions and what is consumerism exactly. So consumerism is defined as the promotion of the consumer's interest, a term that's been around since the 1920s that refers to the fact that businesses have to appeal to the interests and the desires of the consumers in order to sell their goods. And as we all know, since then, retailers and other industries have been focusing on consumer strategies. And over the past decade, technology has really shaped the consumer's mindset and set expectations. So to sum that up easily, convenience and simplicity. Just think Amazon, Apple, Uber, Lyft, DoorDash, all these services communicating to users through their mobile devices and making the process as easy as possible. So let's think about patients now as consumers. Until recently, we never really looked at patients that way. In healthcare right now, it's a big buzzword, but it's also a movement that's changing the reality of how care is delivered. So looking at some of these stats that you see here on the screen, 60% of patients expect their digital experience to mirror that of retail. I would call this the Amazon Prime effect. Over the past few decades, consumers have really adapted their lifestyles around services like Amazon Prime and Uber Lyft, bringing those expectations now into the healthcare market. 80% of consumers have used the internet to make a healthcare-related search in the past year. And I would imagine that this is just going to go up over the next couple of years. 63% of consumers will choose one provider over the other because of a strong online presence. As a patient, we have more options than we've ever had before. In many communities, you'll see several options to choose from when you're selecting a provider or a facility to receive care in. We're no longer just going by word of mouth. Patients are searching the internet to get as much information as possible before making a decision about who they want to provide their care. 55% of consumers say that they've used the internet to comparison shop for care. And so these are all really great points to think about when we start to transition the discussion to what providers are doing and can do to set themselves up for success with their consumers. So as we talk about the patient's expectations, it really comes down to patient engagement. And this really encompasses the entire patient journey, from a patient thinking about coming into your facility to weeks after when they receive their bill or months after. Patients want to be informed, well communicated to, and do so in a way that meets them where they are, like their mobile device. We as consumers are so used to that Apple, Disney-like experience that when we look at healthcare, there's a lot of catching up to do. And this demand and desire that patients have is really bringing significant change in the healthcare market today. There's now a heavy focus on patient engagement and developing customer loyalty. Patients are looking at reviews online and again, not just listening to our family and friends, but 500 of our neighbors on Google. And so the experience really matters. We're seeing a rise in patient access, patient engagement, and patient experience roles in that digital front door strategy that we'll talk about a little bit later. But there's still a significant challenge, and one that's not as easy to identify and address as it is in maybe the retail space. Every healthcare consumer is biologically, demographically, and behaviorally different. But one way that we can certainly address the patient experience in a positive way is the financial experience. If we can simplify that, we can make a drastic difference in the overall patient experience. And in a recent poll to our providers, we found that 100% say that the financial experience has either a significant or a large impact on the overall patient experience. And so that's what we really want to focus on here for the rest of the presentation. And before I turn it over to Mark to talk about other trends in the financial space, we have another poll question here. How concerned is your provider organization about consumerism and patient engagement? And we'll pause there just to give everyone some time to answer. So we may still have some responses coming in, but it looks like, majority of people have already started making changes and have made a commitment to that, which is great to see. So Mark, from here, I think I'll turn it over to you.
All right, thanks, Melissa.
To take us through trends.
Yeah. I think we need to slide on over to the next slide here. All right, so what I'm not going to do is kind of go into a deep dive on all of these new regulations. We could spend an hour on each one of these, but in my opinion, I just want to kind of share some of my thoughts around some of these, and maybe get some of Mac's input on it as well. The Price Transparency Act and the No Surprises Act, in my opinion, that helps kind of solidify and drive kind of a consumerism initiative, right? As a patient/consumer, I want to understand how much is it going to cost for the services that I'm that I'm researching, right? So from a retail perspective, you walk into a Best Buy or any other major retailer, you understand what you're buying and you understand how much it's going to cost, right? The No Surprises Act, again, that's another initiative that kind of puts more pressure on providers to, be able to get the billing correctly if you're doing estimates and all of that. It again kind of drives that kind of retail, environment, if you will. The second two pieces, I'll give you my thoughts on the medical debt reporting rule. There's been a lot of scrutiny around this. There's been a lot of speculation around it. A couple of things in here that I find kind of interesting relative to what we're doing in healthcare. Everyone, I think, understands kind of the demarcation lines around the three major bureaus are not going to report on balances less than $500, but balances greater than $500, you could still, have a negative trade line impact. There's varying positions on should you do that, when you should do it, how you should do that. They've actually extended that timeline from 180 days to a year. So that does give patients a little bit more flexibility to kind of manage those balances and get those satisfied. But there's something that was hidden in there that I thought was very interesting, in that within that year or even after that year, if you actually satisfy that medical debt, you can actually have that negative trade line removed. So I think that kind of drives, more impetus around if you've got, a financing option, pick your brand, pick your flavor. If that, helps the patients satisfy that medical debt to the provider, that could be seen as a benefit, removing those negative trade lines if that provider does actually, do report to the bureaus on those balances larger than $500. So I thought that was pretty interesting. The Inflation Reduction Act, that's a big one. I don't think I've actually gone through the entire thing just yet, but I think it's primarily focused on, pharmaceutical costs, drug costs, and in particular, insulin costs. So we may sit back and think that, okay, we've got an Inflation Reduction Act that's going to help lower the cost of healthcare globally. In my opinion, that's not necessarily the case. It's going to have some, near-term impacts on some specific pharmaceutical costs. But in terms of, deductibles on services, in the acute care setting, we're still going to be fighting those same challenges that we have today for several years relative to that perspective. So I just wanted to kind of share my thoughts on those kind of four pillars that are very popular today, in conversations. So Mac, I don't know if you have anything to add or challenge me on some of that or whatnot.
Oh, far be it for me to challenge you, Mark, on any of that. We've had great conversations. I know that's your knowledge. So I would just add one of the interesting things. I just went last week to Epic's user group meeting. If anyone's gone to their campus there in Wisconsin, I went down a literal rabbit hole. They have an entire area that is around Alice in Wonderland and things like that. It's a fun campus. But one of the interesting things is I met with CFOs at that event where these were the topics of conversation. So these are CFOs of major health systems, and they were all talking about the unintended consequences. And I thought this was interesting, Mark, about the Inflation Reduction Act, where, yes, it allows CMS to make some of these price caps on drugs, prescriptions, et cetera, but it does not and cannot regulate, at least right now, those who are on non-CMS, the people who are with other payers, organizations, et cetera. And so the concern is that they will simply shift some of those costs from the CMS group to those who are outside of the governmentally backed, organizational structures. So it may have some unintended consequences around drug prices, et cetera. It really fascinating. Time will tell where that's going, but I think you summed it up extremely well. And it's just going to be interesting to see how these regulations have potentially unexpected or unintended consequences around healthcare costs beyond those that are directly supposed to address.
Excellent. I agree.
With that in mind, I'll go through just, let's say, I think Mark did a great job kind of going over the highlight reel, so to speak, from the Inflation Reduction Act, but those were some of the things that we pulled out from that most recent legislation. Obviously, these other major landmark pieces of legislation are still having an impact. And Melissa, if we could go to the next slide, I'd love to talk through just for a moment about kind of healthcare inflation more broadly. This is something that we at Class are getting asked about all the time, quite literally on multiple times a week. Provider organizations come to Class and say, what are you hearing? How are governmental regulations, like we just addressed, and or wider inflationary pressures impacting health systems, large and small? And I don't need to tell anyone that's on the conversation today that there has been an impact. It does tend to, as we know, there tends to be a lag in terms of healthcare inflation due to those locked-in contract negotiations that can be multi-year negotiations, but those are coming up for a lot of health systems across the country. And so they're looking at how do we weather the coming storm, so to speak, in terms of both rising costs, cost to replace. We have team members that are leaving organizations. The cost to replace for staff and personnel across health systems is outsized. We have the fragility around nursing. We have the fragility around even clinicians. One of the major initiatives that we at Class are working with is what we call our ARCH Collaborative, where we're trying to measure clinician satisfaction and what contributes and what can ameliorate clinician burnout. And so all of these pressures are on the one hand, while we have revenues dropping. We have revenues dropping, and then of course we have people being pinched with gas prices. We have people being pinched with overall inflationary pressures. And then how does that drive additional need for maybe taking on some medical debt? And again, Mark, I would love to hear your perspective as you have so much experience in the area, but medical debt is something that even with the recent legislation, recent major credit bureaus making changes in terms of how medical debt is going to be impacted or being reported, it is actually something that we at Class see extremely important and actually increasing over the coming years. And so some statistics here, $3,700 is the average family deductible. This has gone up. I think all of us have seen this happen in our own deductibles for our insurance plans, whatever you may be on, both personally and otherwise, increased from $2,600 just over the last few years. The last period of time that Americans faced today's rate of inflation was 40 years ago. And again, this is in the news, that everybody is very, very familiar with it, but the wider impact of inflation has a direct correlative impact on the healthcare and the ability for people to pay for their care. 50% of Americans are burdened by some medical debt. This is also a level we haven't seen really for multiple decades. In point of fact, almost we've never seen such a high rate. Hospital labor costs, as I just mentioned ago, as we all know, those folks that are listening on the conversation today, you are all dealing with these things on a daily basis. And so one of the important things that we are looking at as a community within this space of healthcare is how can healthcare providers weather these storms? What processes can you do? What initiatives can you take? And we're going to have some more information about that here to come in the conversation. But Mark, I'd love to hear any thoughts about that or any counterpoints or additions to anything that I shared there.
Yeah. So again, I'll just kind of share my thoughts, and the thoughts come from a lot of our providers that we've partnered with. Just a couple of stats, right? The out-of-pocket expense of deductibles going to $3,700. That's kind of straight out of the patient's wallet. If you tie that into some industry metrics, around 50% of Americans have less than $1,000 in savings. They don't have access to emergency funds. So if you kind of correlate that to the average deductible, it doesn't add up. It doesn't sync up. So there's got to be mechanisms for folks to be able to satisfy those out-of-pocket expenses. So to me, I think that's kind of a glaring issue, and I think that's also tied into several other market metrics around percentage of patients that are deferring care, right? A few years ago, it was 30%. It's getting closer to 50%. I mean, if you've been out to some of these conferences, there's a lot of folks that are kind of keying into the deferred care situation. And that, in my opinion, ties into, you see headlines every week around major health systems that have posted, a terrible operating income loss because of obviously increased expenses, but their revenues are down as well. So you tie all of that together, in my opinion, with higher deductibles, inability to pay, deferment of care, revenues are down. So it's all, in my opinion, it's all kind of tied together. So just some thoughts off the top of my head around that subject.
And Mark, that's an incredibly important point, in my humble opinion, because we at Class, again, when we talk with these healthcare CFOs, VPs of revenue cycle, et cetera, they're all saying the same things. We want to deliver that care. And to your point about deferment of care, what is the impact on the patient experience, right? Their health. During the pandemic, we saw this in a macrocosm where we saw people who deferred colonoscopies and other ostensibly elective procedures, but because obviously of COVID shutdowns and things like that, now we're starting to see a little bit of a reaping of that whirlwind as people are recognizing, and clinicians obviously knew at the time, but their hands were tied, right? They had to see those COVID patients. They had to clear floors and put all hands on deck. And now we're seeing the knock-on effects from some of those things of deferring treatment. We all can appreciate the effect that it can have, the deleterious effect it can have, and of course, the financial impact. So the greater financial impact down the road. I just took my daughter to the dentist yesterday, and I remember about a year ago, he said, well, we can treat this tooth, but it's a baby tooth. It might come out. And if it comes out, then we don't need to worry about this cavity. I wish we treated it, because you should have seen the bill for the today that I had to pay. So, a penny saved is a penny earned. And if we can help help the patients have a better experience, a more consumer-driven experience, not only is it better for their health, which is paramount, but it can be helpful for them, obviously, with their finances and weathering these coming storms around wider inflation, et cetera, is my humble opinion there.
I agree.
Mark, did you want to go over this information here?
I can. So I guess what we're looking at here is the relationship between business office satisfaction and bill payment. So obviously a survey of over 500 healthcare customers found that fully satisfied and satisfied individuals are more likely to pay, right? If they understand their bill, they've got a vehicle and a mechanism that makes it easy to pay from a digital perspective. They're gonna have a much more likelihood to pay in full. As that experience kind of dwindles, if you will, where they're obviously not satisfied or very dissatisfied, the metrics skew the other way. So kind of the whole patient financial experience, I think, is paramount. It's at the end of the road. If, we hear it all the time from our providers that they've had a great clinical experience, and you wind up at the very end of the journey, if we can't wrap that around and have a comparable, patient financial experience with understanding their bill, ability to pay, and options to be able to pay that, there's going to be challenges. So those are kind of my thoughts on that component.
And for this area here, and again, just to reiterate a little bit, that we have seen this in our own research here at class. When we talk with provider organizations, just like you said, Mark, when people have that high level of experience, providers are looking not just to say, okay, how can we increase revenue? How can we deliver quality care? But also, we want to be seen as innovative. We want to be seen in our community as helpful. And when the last experience, so to speak, you had that great clinical encounter, just like you said, Mark, you had this great experience where maybe you have a fantastic nurse or clinician team that is there helping you, and you feel better and you've actually recovered from something or had that experience. And then you get this very Byzantine, very difficult to read bill. You get an EOB. Do I pay it? Do I not pay it? Do I wait till I get something from the anesthesiologist? Then I got something up to the hospital and I get this and that. That confusion leads to then just a really sour taste in their mouth. And so a lot of providers are looking not just to have a better revenue experience and to drive additional revenue, but also to meet patients where they're at and to provide these types of solutions by having that online presence, being able to have estimates. We obviously understand with the Price Transparency Act, very important, top of mind for a lot of provider organizations. How can we meet patients where they're at and provide a clear delineation of potential services so that we can help be both in line with regulations and governmental strictures, but also make sure that we are delivering the quality of care that needs to be there and be seen as an ally, not just as an organization there to deliver care, but an organization to deliver care and to do it in a way that makes sense. One of the things that our research shows here at class is that most folks want to pay their bills, particularly with medical bills. They see that as something that they've received a real value for what they are being billed for. And when it comes to medical bills, most people, the vast majority, want to make good on those bills. Meeting those patients where they're at, providing a compassionate plan to a tailored plan with options is really essential both to the patient experience, but then also ensuring that we are delivering that revenue for the health system so the health system can continue to deliver that quality of care. Any thoughts about any of this, Mark, on this slide? I'd love to hear your thoughts here as well.
Yeah, there's a lot of thoughts. I don't know if we've got enough time to go through all of that. But again, this kind of ties back, in my opinion, back to a drive towards a more retail-oriented experience. So, we're seeing providers starting to shift significantly to price transparency, obviously, estimates, a move to scheduled services, right? That's where the revenue is at. How do you financially clear folks as you go through that whole journey? So you have to have technology, you have to have partners that can accommodate for the estimates, if you're going to get on the schedule, if you're going to collect at the point of service, if you want to collect pre-service, how do you manage all of that stuff? What's the technology that's wrapped around that? There's a lot to talk about that. But that, again, it drives right back into kind of that retail experience that you're going to have at a Home Depot or a Best Buy or one of those types of experiences. We're also seeing this patient balance management moniker show up more and more throughout organizations on how do we manage that patient balance, right? They're putting teams together, they're putting leadership positions together to manage that specific initiative. But again, what tools and technology do you have that bolt on to managing patient balances, right? Is it the tried and true methodologies that we've experienced for the past 25 or 30 years through normal collection tactics and billing initiatives? I think there's a lot of technology out there that is kind of shifting that landscape. So I think all 6 or 8 of those bullet points kind of tie together, driving towards a more retail type experience.
One of the interesting things, we recently completed a report on the patient financial experience, and one of the things that came out to me in talking with healthcare organizations, some organizations really see the digital first approach, having the ability for people to actually make their payments online, providing flexibility around that as the preeminent vector for communication. And absolutely it is. I think that is where the future of engagement is going. At the same time, there are still some demographics and patient populations that, for whatever reason, still value a digital or paper statement. There are some benefits to some of that. I think having a broad-based approach, allowing multiple different opportunities for that patient to make, to understand and to make good on their financial obligations is an essential part of that. And that's one of the things that I see here on this, the content that we're sharing. Having a single guarantor, having that transparency, that clarity is really important. It's hard to do that. It's hard to make sure that you actually are pulling the data all together in, and you need to find an organization. If it is a bolt-on or an add-on, you need to find some organization that can provide some of those things. I want to talk about vendor consolidation just for a quick moment, if I may. This is a trend we've seen over the last few years in the area of financial engagement, more specifically with Waystar's acquisition of what was Patient Co. R1, very familiar from an end-to-end RCO space, with their acquisition of VisitPay. There's a lot of consolidation happening with some of these non-traditional financial engagement specific vendors. And then there's also some consolidation around like teams like RevSpring that have both their TalkSoft solution and PersonaPay, and then of course HealthPay24 that does the same. So there's a bit of a melding between and a blurring of the lines between what has traditionally been considered patient engagement, more traditional communication. So messaging, you can self-scheduling patient education, people being able to go in and change their appointments, things like that, or doing check-in for appointments at a clinician or the office. Those things are kind of blurring the lines between traditional roles and financial engagement as well, particularly where it's looking forward to, collecting that copay, pre-service estimation that we've talked about a little bit. So these lines are really pushing from the back end towards the front end of the experience. So making sure that as the patient comes into the system, ostensibly, they're able to understand what they're supposed to do. They're communicating with their clinician, they're scheduling, they're making good on their bills, and we're actually finding ways to help communicate. And there are teams like HealthPay24 and others that are doing things around articulating that right from the very beginning or prior to being seen for a scan or a visit or a doctor's appointment. And being able to see that kind of progression going through is an important part of what some folks are starting to call the patient journey. This is something that's been around for a long time, that those terms, that terminology, but integrating the financial engagement aspect of that within the patient journey is, I think, the next opportunity for health systems to look and say, how do we as an organization bring that person in? And something else that I brought up recently from a chief experience officer, this is a title we've seen more and more adopted across large health systems and other health systems, is how do we have that patient become our lifelong patient, right? So how do we have that patient continue to have not only a great clinical experience and a great outcome, hopefully, and most importantly, but also help them have a great financial experience? How do we get that buy-in from the patient to continue to utilize our health system and feel that we are, again, a partner, we're a help to them, as opposed to just delivering care and then sending you a difficult bill later on. So these are all things that I'd love to hear your perspective on, Mark. But and again, we can kind of go to the next slide, I think, on talking about a little bit about the what's next. Any thoughts here, Mark, before I dive in? I've got a few thoughts. I'd love to hear what you have to say about the consumerism. I know we've talked a little bit briefly about where some of these things are going and how this can happen. Any thoughts here?
Well, yeah, it's not going away, and I think it's going to accelerate, in my opinion, because at the top of this presentation, I think Melissa hit the nail on the head. Right, people are getting more accustomed and expect the kind of the Amazon Prime type experience or the Uber Lyft type experience. All that's driven by technology. So I think this kind of drives back to the previous slide. You don't have to go back to that previous slide, but you mentioned a lot of players that are in that space, and that just kind of validates the technology piece of this, right? You have to have payment ability, and then you have to have payment options. So again, I'll take you back to a Best Buy type example. You walk in, you've got your goods and services that you're going to buy. There's payment methodology for you to be able to make that transaction. They also offer, payment options as well. So all of those platforms that you mentioned, they've got, multiple different variations of payment options that are in there. And I think that just helps solidify and kind of drive that, the consumerism model of that. I think the regulatory piece, the second bullet on here, that's not going away. The price transparency piece, the people that are pushing, providers that are pushing estimates, getting scheduled surgeries, that's not going to go away. I think this simplifying the patient financial experience is a must, right? People are going to have to understand their bills. They're going to have to be able to consolidate their statements. They've got to go onto a clean, crisp portal that's going to display that information. That's your payment methodology. And then how do you pay for that? If you can pay in full, that's great. Everybody wants that. What are your other options? And what's the ease of use with those other options? I think it's a must. So those are kind of my thoughts on, the past two slides. Matt.
And we've got a lot of questions coming in, which is wonderful. And I'm actually trying to multitask here and look at some of these great questions. I look forward to answering as best I can. Obviously, Mark will be better at that. But I'd love to go to the next slide really quick, Melissa, if I may, and talk just a little bit about what providers can do. So one of the key takeaways that we were hopeful to share from the conversation today is not just where are things today, but obviously where are things going, and hence the crystal ball a little bit there. Investing in technology, and again, Mark, you touched on this, which I think is absolutely essential. Being willing to invest, and this is something we get asked a lot about here at class, is automation. How can we streamline this? Again, when I talk with health systems over the last 3 to 4 months, there are 3 things they want to talk about: staffing, staffing, and staffing. Those are the three topics that they bring up. And I joke a little bit, but the purpose of me sharing that is if you've gone to a restaurant in the last few months or the last year and seen a sign that says, please be patient while we are dealing with staffing shortages, this is endemic to the whole economy, not just healthcare. But I think healthcare has obviously been exacerbated because so many of these folks and so many of these wonderful team members have been at the tip of the spear and under incredible amounts of pressure through the pandemic, et cetera. And so I think it's led to early retirements. It's led to people leaving, gone from facility, moving vertically or horizontally throughout health systems, looking for other opportunities, working remotely if possible for some roles and so on. And so all of that has led to a tremendous amount of churn in the health systems. So finding ways to invest in technology that can help you streamline processes that may have traditionally been more in-house or labor intensive. This is one of the major areas that health systems should be looking for and are looking for right now. Integrations. Whenever possible, finding opportunities to look for those systems that play nice with others, making sure that you are streamlining processes, not creating additional workflows or additional work is always important. And then, of course, digital front door. This is something that we at Class are still trying to help providers and also to have providers help us to really delineate, okay, what constitutes digital front door? One of the best phrases I heard, one of my colleagues here at Class was speaking with a CMIO who said, look, it's less digital front door and more of a house, right? So they come in through a door, yes, but then which room do they get assigned to? Which window are they looking out of? Which rooms are analogous or adjacent to other rooms so they can move smoothly within the organization through that house? I think there's an argument here for digital front door like AI before it. These are terms that get bandied about, but finding out exactly what that is and what organizations do well with those things, that is something that we at Class are looking at really closely, and we'll continue to do so. And then, like I mentioned a moment ago, focusing on pre-service, right? So moving from bad debt and collections, traditional collection type roles, to how do we meet patients before the visit, pre-service visit? How do we find ways to meet patients where they're at and provide a very seamless, streamlined process for them to get the care and, frankly, focus on getting well and not having to worry about how do I make good on these medical debts and obligations. These are all things that we can do. Mark, any thoughts on that? And then I think we have one last poll question as well.
Just kind of some, closing remarks around technology. There's a lot of investment in healthcare and technology. They do that to alleviate some of the staff burden and staff touches on a lot of these processes. So if you're not integrated, within, digital platforms, your HIS, HIM systems, it just becomes a cumbersome task, an additional cumbersome task for staff. And it's in those areas in patient access and business offices where you have the highest turnover. So I think the technology play is very important to limit the staff interaction. No one has time to, leverage their IT departments for another implementation. It has to be pretty seamless and self-serve oriented, in my opinion. So I think all of those bullet points are spot on for sure. And again, moving the conversation to pre-service, I think, is key. Rather than chasing those dollars post-service, we all know how difficult that is to collect. The collection rates, as those balances get higher and higher and higher, the liquidation rate goes way down. Let's clean up that conversation before they get into their service so they understand what their options are. Alleviates a lot of the anxiety from the financial burden perspective of it. So I do think the focus on pre-service, or the shift to pre-service, not everybody's doing it. There's a big shift moving that way. So I think that's a big initiative.
Yeah, and I just want to highlight what you said earlier, Mac, about the vendor integrations and playing nice with others. I think that's just really important when you're looking at vendors and you're talking to existing vendors before making a decision and moving forward. Because a lot of vendors will do, they have a focus on one thing, but when you talk about the entire patient journey, you're starting to incorporate and see more integrations with various vendors and playing nice with each other. So I just want to reiterate the importance of that, as we move forward to see what's next, choosing vendors that do work with others.
Excellent. Thank you so much, Melissa. I'll read this question. I love this question. I'm looking forward to hearing from the respondents your thoughts here. So the question is, what's the biggest challenge you've had shifting your patient engagement strategy in the past year? Number one, offering affordability options, i.e. payment plans, loans, financial counseling, integrations, or finding solutions that talk to each other, automation, making life easier for my staff, collections, getting patients to pay on time or at all, full transparency and visibility into a bill, history of a bill, estimation, et cetera, or are there other thoughts as well? So I'd love to hear the responses here. So about 20% or so. Okay. And this is fascinating. And again, candidly, kind of in line with what I hear when I talk with healthcare organizations, but automation and integrations kind of taking the top spots there. I really appreciate the perspective on full transparency and visibility into a history of bill estimations. I'd be curious, I wish we could do a follow-up poll question, but maybe we'll get some of these in the commentary. I'm curious if that full transparency and visibility, is that driven by regulatory changes? Is it driven by other factors that your teams have seen? But again, there may be some comments that we can get from this. And I do want to take time to answer some of these great questions we've had coming through in the chat. So we'll go into that. But Mark, any thoughts here on these results?
It doesn't surprise me. I think all of those, other than the other, should be headlines for anybody that's, in healthcare today, right? The affordability piece is not going away. You have to have the interoperability with all of the technology that we have out there. So that's a big thing. I mean, we all know that Allscripts, Cerner, and Epic, right? There's a lot of money that's invested in that. So whatever platform solution that you have, it needs to work well with each other. The automation piece, I kind of, my piece on that would be make it easier on your staff, right? Let's get the staff burden off of stuff that we can automate and throw technology at it. So, and then obviously collections to pay a time or at all. So I think they're all headlines. So, and it's a fairly even distribution. I mean, at least 3 of them are fairly even. So yeah, I'm kind of surprised only 7% are worried about collections. I mean, there's a lot of folks that have bad debt and growing, ballooning AR portfolios. So interesting.
All right.
So we will go ahead and jump into our Q&A today. Thank you to Mac, Mark, and Melissa for that great presentation. You can continue to submit any questions you have by typing them into the Q&A chat box on your webinar console, and we'll go ahead and get started. First audience question: what success stories have you seen on ways providers can prepare the entire workforce, new and existing staff, to be patient/consumer-centric with daily behaviors and decisions?
Wow, that's a big question. I'm trying to find it in my Q&A box down here so I can read it. Can you go through that again? I can't seem to find it on my dashboard here.
Sure, yeah, absolutely. So audience member is wondering, what success stories have you seen on ways providers can prepare the entire workforce, both new and existing staff, to be patient or consumer-centric with daily behaviors and decisions?
I'm assuming they're wanting a personal perspective on that. One that I can kind of give from our camp is, Banner Health, based out of Arizona. They're a huge health system. They've got one of the most efficient revenue cycle departments in the country, if not the top one. They've had a complete shift from post-service collections to pre-service collections. So as you come in and you want to have a scheduled surgery, they're doing a financial clearance. They're doing the whole suite of eligibility. They've pushed that whole initiative up front to pre-service, and it's been a huge success. I don't know if anybody on the webinar knows Becky Peters out there at Banner, but if you don't, you can look her up on LinkedIn and ask her some questions. It was a pretty significant revenue cycle redesign. There's a lot of technology that's wrapped in it, a lot of different players, but it's a pretty big success story in terms of the vendors that they selected, the training processes that they put in place, and then the outcomes that they've had. So it's a pretty big success story. I'd look into it if you want to get some little bit more detail on that. Hopefully that answers the question.
All right, next audience question. With the amount of new technology in digital health patient engagement, how much vendor consolidation are we truly seeing? Seems like there are more vendors with tools popping up every day, so the vendor consolidation piece seems contradictory to the behavior in the market.
I can address that one if that's okay. Adam, this is an excellent question, and I actually saw it pop up, and I thought it was really a timely question as well. So we at Class, again, measure over 900 solutions with 400 plus vendor and service firms, and so we get kind of a view of the market in aggregate, right? So with whether it's Oracle and Cerner, all the way to Microsoft Nuance, all the way down to more granularity in some of these subsections. The trend tends to be a bit of an oscillation, right? So we go through these oscillating cycles, especially in financial engagement around startups, to your point, tools that are popping up. They innovate, they disrupt in a positive way, hopefully, typically. And then what will happen is the larger organizations will look at that and say, okay, rather than trying to develop this ourselves, we'll simply inorganically acquire and then take that in. And those go either one of two ways. They either go really, really well, or they go really, really poorly. It's rare to see an acquisition really work just smoothly down the middle of the road. And so it's a great question. And so we at Class, again, are looking at the marketplace and saying, okay, we are seeing a bit of a consolidation phase right now. But to your point, and Adam, I think it's a great point, we are still seeing folks coming into the marketplace with tools, with specific solutions. We've done what we call spotlight reports, where we do specific reports on just small solutions that maybe only have a handful of clients to validate what's real, what's not real. We did one recently on a company called MD Save that provided effectively like a Groupon for healthcare, where you could go in, you could pre-shop your procedure, you can select the procedure, and then you get a bit of a discount for doing so. And the value add for the health system is obviously bringing in additional patients, but then it does provide a benefit for the patient themselves in a very consumer type experience. So there are things like that happening, and we will continue to see that happening as the marketplace kind of shifts that way. But consolidation is here to stay. It is something that I think the larger organizations are looking at and saying, look, rather than try to develop it ourselves, we can simply go out and inorganically acquire and then inculcate it within our extant workflow or offer it to our existing client base and go from there. So, and again, it goes either really well or really poorly. It just does depend. But we are seeing a bit of that. We are seeing that happening right now.
All right. Thank you, Mac. Next question we have up. Audience member wondering, can you please discuss the importance of EMR and patient engagement / education systems integration, and any experience you have with mitigating the barriers that exist between integrating vendors / systems with the EMR?
Mark, you want to take a stab at that one first?
I wish I could be a subject matter expert on that particular topic. I'm not. I'm more in the finance world. So unfortunately, I don't. I would just be making something up. Maybe Melissa has got some insight on that. Because HealthPay24 has got integrations with various different platforms, EMRs and HIS systems. So not trying to dodge the question, but that's just not my. That's not my area of expertise in detail.
Yeah, certainly. And it's definitely a challenge we see with a lot of our clients. Like Mark said, at HealthPay24, we integrate with a lot of different systems out there. One of the struggles that we see is actually getting the data out of there. And something that, we at HealthPay24 have moved to is an API integration. You're able to get more real-time information to and back and forth to the various systems, which helps in a lot of for a lot of different things. The whole user experience, it comes down to having that just real-time integration and not having to wait for daily files to run and things like that. So I would say that's one way, and then the other way is just getting the data out of the system. So working with those EMR vendors to extract that data. So we've seen, if you're working with a big system, some of our clients have maybe some smaller EMR systems that aren't as well known. They bring in consultants to help extract the data and things like that. So there's another way of working with them. I hope that helps.
All right. Thank you, Melissa. And my mistake, I actually see that I skipped over an earlier audience question. Make up for that now. Do you see omni-channel engagement increasing in the form of more digital payments versus statements or phone calls?
I'm happy to help there a little bit with that question. It's a very, very important question. And the answer is, I'll try to keep it as short as possible, as brief as possible. I think we do see omni-channel engagement increasing. Definitely digital is the foci, and it needs to be the focus. There are opportunities to have a better consumer type experience, but even when you have a health system, and I mentioned this earlier in the conversation, some demographics and some populations, especially in even certain regions of the country, have different needs in terms of how do you reach those patients. And a question that someone just asked recently here was, how do you see the impact of health discrimination on patient engagement and experience? How do we assess the financial cost? Excellent question there as well, and it's tied into that a little bit of the same question, which is, how do we reach these people who are these underserved populations, people who are at the most at risk? And one of the things that I think is really fascinating, research shows that close to 89 to 90% of indigent populations in the U.S. have access to a smartphone, whether that's through a government program, other things. So even with those folks who don't have a mailing address, even those people who are the most at risk and they tend to, unfortunately and tragically, be people of color primarily. How do we reach those people and meet them where they're at? And we need to be innovative. Health systems need to be conscientious about it. And I think that's where the omnichannel communication is essential. It's not going to just be digital only. And without sharing who it was, I spoke with a health system who talked about a vendor organization that really promulgated a digital only type strategy. And that was leaving some of their population behind, some of their client base, their patient base being left behind because they simply were not able to reach them where they're at. So it's really essential that we are conscientious and careful about how do we make sure that everyone has an opportunity to receive clear transmission of information about their care. And I'll just share this really super briefly. One of the fascinating aspects of this is, and Mark, you touched on this earlier, which I thought was great, when we move to pre-service and reaching out to people before even they attend or go to their clinician, we're getting buy-in on the part of the patient to engage with the health system and engage in their own care, engage in themselves, and being a participatory in the process, not just a bystander taking instruction, following instruction, but someone who is able and empowered to be able to understand why they're receiving the care, understand what they're being billed, and understand what the purpose of the care is. And they tend to have better outcomes as a result. This is something that we've seen through our research that I think is really a great byproduct, an unintended happy accident, but a wonderful consequence of that.
All right, thank you, Mac. Next audience question. The word consumer sort of ignores the fact that healthcare is the only profession that deals with life and death. Consumers and other entities don't deal with those stakes. What are your thoughts?
Wow. I guess my initial, yeah.
Oh, go ahead, Mark.
My initial response to that, quite candidly, is I think it's all the more reason that we need to embrace, technology offerings, platforms, portals for folks, because we are dealing with healthcare issues. We're not dealing with flat screen TVs or appliances or mattresses or what have you. So anything that's going to break down the barriers to access to healthcare, understanding healthcare, and affording healthcare, I think are very important, most important. So, I mean, that's kind of my initial kind of visceral reaction to that is we're trying to make healthcare more consumer driven and more consumer accessible. So that's kind of my initial response to that.
If I may just add really briefly. Oh, sorry. Go ahead, Melissa, please.
Oh, no, I agree totally. And I think what I was going to say is that I think it is a controversy, to say that patients are just like consumers, because they are in some ways, but they're not. And I think what the point of, bringing the consumerism idea into healthcare is just the idea of making it simple and making it easier for patients, because that is what patients want. And when we, again, kind of just going back to what we said earlier, just that experience that we're seeing with Amazon and some of these other, retail services, that patients are used to that. And so they just want that same experience in healthcare. And it should be in some ways, but in other ways, it certainly is never going to be 100% like it is in other industries.
I'm really glad, Melissa, you spoke first, because you summed it up much better than I was going to.
All right, well, perfect. We have time for one or maybe two more questions. Next one up. What we have found is approximately 50% of patients want to pay their bill online, and 50% still need help and want to talk to someone. How do their digital-only companies deal with the patient calls when they do not have call centers?
This may be a question for Melissa or Mark. I'm happy to offer some perspective, but I'd love to hear what you two have to say.
Yeah, no, I'm actually glad that you asked this question. Sorry, Mark. I'll just
go for
something
it,
to add briefly here. In regards to that, obviously there's a rise in the digital strategies, and patients are looking for that. But there's also, we talked about the demographics of patients, and it is different, in where your location and who your primary patients are, and so it's something that you have to think about. And I don't believe at this point in time we are ready for 100% digital strategy. What we're seeing at HealthPay24 is there's still a need, and there's still a very strong need for an IVR system. That's the integrated voice recognition, the over the phone payments. Patients are still using that, and they're using that more now than they were just a few years ago. So there's still a rise in those types of ways to pay. So I don't think, the strategy is going 100% digital, again, just based off of your demographics. But you'll see a rise in, millennials and, different generations that are starting to now use the healthcare system more and more. They're expecting that. So it's, again, you have to have that, all those omni-channel options is what it comes down to.
I agree. There needs to be a mix. There always needs to be a mix of that. The pickup is on the folks that want and expect that kind of digital experience and environment. We've seen very significant engagement there. And it also, we're not funneling everyone back to the business office to answer calls back at the provider. So, it addresses the staffing issue from the provider side as well, when you can pick up those folks that can self-service and take care of the bills from a digital environment. So I agree with everything you said, Melissa, for sure.
All right, we're going to try to squeeze one more in. As the patient's financial journey and strategies change, are you seeing a shift in the strategies surrounding financial assistance programs?
I wouldn't say a shift. I would say a bigger awareness of programs, right? You've got presumptive charity, you've got 501R, you've got financial assistance plans. Almost every provider's got an initiative around those, but there's going to be folks that fall outside of those, government assistance, charity type platforms. And, what is your strategy around that to address that part of the population? So, affordability is not going away. Deductibles are still increasing. So I think the need for options for folks to satisfy their out-of-pocket expenses are going to continue to accelerate. So, that's how I would answer that. Every provider is different on their focus and initiatives around, government charity type 501R type programs, how they, deploy those and manage those and enroll folks into those programs. I've seen it across the board, but I wouldn't say a shift, in my opinion. So.
All right, thank you, Mark.
I would use the term refinement. There's been a refinement in some of the strategies, right, as opposed to a shift. I agree with you 100%, Mark, but a refinement of the processes, looking for how can we find efficiencies in some of that. I know we're at time, so I just wanted to say thanks, everybody.
Yeah, Absolutely.
Yeah.
Thanks,
Thank you,
Mac.
everyone.
And thank you to our wonderful audience for that great engagement, tons of questions. Thanks to Mac, Mark, and Melissa for the excellent presentation, and HealthPay24 for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and stop by HealthPay24 and or Curay's booth at the Becker's Health IT, Digital Health, and RCM annual meeting at Navy Pier in Chicago. Thank you for joining us today. We hope you have a wonderful afternoon.
Thank you.